After the tone, please record.
Hello everyone, my name is Jessica Sharp and I'm here from the Children and Young People's Mental Health team at NHS England. We've put on this session this afternoon to talk through how the case study of how Bromley Y has been flowing data to the mental health services data set. What we're going to do is we're going to have a run through their experience, but we also have NHS Digital on the line ready to provide some technical guidance about how you can be doing this yourselves if you're struggling. So I will hand over very shortly to Aaron Leasley from NHS Digital and also to Claire, who was formerly at Bromley Y, but who is currently at London and South East Children and Young People's IAPT Collaborative. They'll be taking us through the session today, and on the final slide we have contact details for anybody who might have any further questions. So I will hand over now to Aaron.
Thanks, Jessica. So hi everyone, my name is Aaron Leafley and I work in a team called the Dataset Development Service at NHS Digital. So in particular, I work on the Mental Health Services Dataset, the MHSDS. Now our team lead on the design of the dataset, i.e. what data should be submitted to allow important analyses to be undertaken. We also support the submission of data in collaboration with the EXA Help Desk through the various guidance documents we provide. I'll just introduce Claire now. Hi Claire, would you like to introduce yourself?
Hi Aaron, thanks Jessica. I'm Claire Ely and I'm clinical lead for CYPI in London and the South East. And I was previously director of a third sector service, Bromley Y, which has managed to acquire an HSDN, and today we're going to be talking about that process.
Thanks Claire. So, about this presentation. So who's this presentation aimed at? So the presentation is aimed at organisations that are providing specialist secondary mental health care, i.e. they're in scope of the MHSDS, but they're not yet flowing data to the MHSDS for whatever reason. So looking at the latest coverage report for the MHSDS, we now have around 106 organisations submitting data. But we are aware that there's small pockets of missing data across the country. So this presentation will be focusing on some of the steps that must be in place in order for an organisation to be ready to submit data to the MHSDS. And that's via a secure Bureau service portal. So hopefully the presentation will cover some of the key steps that providers that aren't currently submitting can start to consider locally and start getting these processes in place. And so as part of the presentation, Claire's kindly offered to do a bit of a case study from Bromley Y, and that will provide further practical examples of how these steps were implemented within a third sector service provider, i.e. sort of converting what we can often complicate and provide quite technical language, just try and bring it a bit more closer to home about what an organisation might actually need to do to start submitting the data. So why have we put this presentation together? Now, obviously, the Dataset Development Service work very closely with organisations to navigate the process and to start getting the data set up and running within their organisation. And quite often, we've found out that the technical aspects of getting registered and all of the appropriate IG considerations can be quite a lengthy and burdensome process, particularly for sort of smaller organisations who may not have large information teams. So this presentation is going to look at each step in turn and try to address some of the common FAQs or misconceptions that we're aware of. Now, just to sort of clarify really, the non-NHS organisations may encounter some of the steps we're going to be talking about only as a result of commencing MHSDS data submission. However, I just wanted to highlight that some of these steps, once implemented, will have much wider benefits to the organisation than just the MHSDS. And some of the steps should really have been done anyway, irrespective of the MHSDS. So we'll come on to that as we go through each step. So I'll just hand over back to Claire again, and Claire's just going to talk about Bromley Y, and where they were and where they got to in terms of submitting data to the MHSDS.
Thanks, Aaron. As I said, I was formerly director of Bromley Y, which is a third sector single point of access CAM service in South East London. It's now also a beacon site for CYPI Act and a Cork accredited service for its use of ROMs. In terms of talking about the whole process, it came about because in 2015 we won a tender to deliver a single point of access. And previously to this, we were carrying out in-house audits using pre- and post-ROMs and sharing the information with commissioners and service users. But winning the tender meant that we were then having a huge increase in referrals coming into the service, roughly 3,500 per year. And as a result, this created a huge amount of data for us to process. Although we were primarily funded by the local authority, by the new transformation monies, the CCG began to contribute to the commissioning, and as such, we were then obliged to flow data to NHS Digital because we had CCG funding. So we had a bit of a dilemma. We were unsure how we were going to do this because we didn't have a secure connection, and we wanted to be able to do it independently. So we began the process of acquiring a health and social care network to flow the data securely. Thanks,
Claire. Yep. So before we start going into the detail, it's just worth highlighting that all of the guidance we'll be going through later down the line in this presentation, that will all roughly already be in existence in some form or another through the existing MHSDS guidance documentation. So on this slide, I've just included a couple of links to the two sources of documentation. And just to draw your attention to a couple of particularly key documents. So the first link is to the Formal Information Standard webpage. So the MHSDS is an information standard that's approved by the Data Coordination Board. And as part of that approval, there's a page that contains sort of the formal information standard document. For example, the requirement specification. Now that's a must-read for all services. And that sort of talks about who needs to submit and when. It also outlines all of the conformance criteria about how we will check organisations are conforming to the standard. There's also an implementation guide document. Now that's a really key document because that talks through the end-to-end process of how new and existing submitters would approach the data set and how they might choose to implement that locally. So that covers concerns such as information governance, consent, data quality, and it also provides a variety of sources of information for services to consider. Now there's a second page that our team, the Dataset Development Service Control, and that provides additional guidance on top of the formal documentation. And in particular, the technical guide contains all of the step-by-step processes for submitting the data through the Bureau Service Portal, and that's going to be the focus of today's presentation. There is also a user guidance document on that webpage, and that's got a lot of useful information about what are the mandatory tables within the data set, how you can interpret the data, looking at some of the scenarios that can cause difficulty with mapping the data. And on that webpage, there's a lot of other documents as well to help providers tackle the data. So before we go through the technical requirements to enable data submission, I thought it's worth putting this step in context of a wider implementation plan. So on this slide, we've got a table that outlines sort of the full end-to-end process of implementing the data set within an organisation. And you can see the steps highlighted in green, they're going to be the focus of the presentation today. So just to put these steps in context, just going through the steps individually, well, the first step would be for an organisation to work out if they're actually in scope of the MHSDS, so they know whether they need to start flowing the data. And the column on the right-hand side has got some of the documentation that will help providers to understand these steps. So for this step in particular, the requirement specification will tell you exactly what organisations are expected to submit, and when they're expected to submit the data. So as part of implementing the data set, you probably want to identify and engage with key stakeholders. Now that's both within your organisation and outside of your organisation. So internally you might want to set up reference groups or set up methods of communication between the clinicians and informatics colleagues. But you may also want to discuss with wider organisations such as your commissioners and NHS Digital. So once you've come up with a bit of a plan about how you're going to tackle it within your organisation, you'd want to start looking at the data set and what data we're actually asking to be submitted. Now the data model and the technical output specification go into this level of detail and define exactly what we are asking to be submitted to allow us to do national reporting. Now once you've worked through the data set and understand what the data requirements are, you'd then do a local data mapping exercise to work out, are you collecting this data, and if you are, how can you extract it for submission? And as part of this, you just want to check your information governance policies and ensure that you're in conformance with IG requirements generally. So once you've got all of the data in a format that you can start submitting it, then you need to work out how am I supposed to submit this data to NHS Digital. And that's going to be the focus of today. So we're going to look at the technical requirements to enable you to start the data submission through a secure Bureau Service portal, and in particular how you can obtain log-on credentials for the Bureau Service portal. There are some steps after that, because once you've submitted the data, it doesn't just disappear and you hear nothing back. When you submit the data, we provide quite a wide variety of data quality feedback. That's at the Secure Bureau Service portal, but also after submission. So the process doesn't end there, and the process of improving data quality is sort of a round cycle where you submit the data, improve the data, resubmit. So yeah, it is an ongoing process, just to highlight that. And the last row in this table as well is just to make sure that providers get signed up to our email notifications, and we do provide the monthly newsletter as well for the MHSDS within NHS Digital. And so a more detailed version of this table is available in the implementation guidance document. And we also have converted this table into a planning template, which is available on the web pages I highlighted earlier. And that you can print that out and use it as a checklist as the organisation goes through these various steps. So in terms of the technical requirements that we will be going through today, so to submit the MHSDS data, this needs to be submitted securely through the Bureau Service portal, which is hosted by the Open Exeter team in NHS Digital. And to be able to get access and flow the data securely, there's various other requirements that an organisation needs to have in place. And these are broken down as 6 key steps. So the first step is to ensure that the organisation has access to the secure health and social care network. The second step is to make sure that an organisation is registered with the Organisation Data Service. The third step is to check your organisation's conformance with the Information Governance Toolkit. The fourth step is to ensure that the organisation has a Senior Information Risk Owner, a CIRO, registered. The fifth step is to submit an application to get access to the Bureau Service portal. And then the sixth and final step is that once you've got your access, you may need to adjust your firewall and IP addresses to make sure that the Bureau Service portal works effectively. So we're going to go through each of these 6 steps in a little bit more detail now. And after each step, Claire's going to jump in and talk about how Bromley Y approached this particular step, and if there's any sort of general tips that can be taken away from undergoing this process. So the first step is gaining access to the Health and Social Care Network. So what is the HSCN, the Health and Social Care Network? You may have heard of the N3 network in the past, and the HSCN is the long-term replacement for the N3 network. Now, you may already have access to an N3 or HSCN connection, in which case the next couple of minutes you may want to go make a cup of tea. But in the meantime, those that don't have a connection, I'm just going to describe what the HSCN is and some of the practical ways to get hold of such a connection. So in terms of the HSCN, it's a method of accessing and exchanging electronic information across the health and care setting. Now, it isn't a system as such, i.e. you won't be inputting data onto the HSCN. It's just a method of the transfer, and it allows NHS Digital to securely receive and process secondary uses data, such as the MHSDS, from provider organisations. Now, it doesn't replace your local needs for data flow in any capacity, and providing your existing system can extract data in line with the MHSDS. There's no need for you to sort of change your local system processes, etc. You just need the connection to be able to access the Bureau Service portal. So there's a wealth of guidance available for the Health and Social Care Network provided by a separate programme team. So we've included a link to the website where you can find all of the documentation. And if you do want to contact the team directly, you can contact them through our central NHS Digital inquiries. So why we're promoting the HSCN? Well, as I mentioned earlier, it's essential to enable to submit data via the Bureau Service portal, and that's again described in our technical guidance document. So such a connection will not be checked as part of BSP registration. So I guess the key point for this is that some of the steps I've outlined in the previous slide can be undertaken simultaneously, i.e. the 6 slides are not necessarily in chronological order, and it does depend on where you are against them 6 steps. Decide on which one you might want to tackle first. So for example, with the HSCN, if you went ahead and flew through the process to gain a BSP account, but you don't yet have a connection, well, you've got an account, but you won't be able to log into it. So to get to the end goal, all of these processes are in place, but you may want to start some of them sooner than others. So if you currently don't have a connection to the HSCN, and this is particularly relevant for smaller independent or voluntary organisations, this process can be quite complicated and financially significant. So we're just going to cover some of the practical ways to obtain a connection within your organisation if this is the case. So a range of options exist for to achieve a HSCN connection, or actually to negate the requirement to have one yourself. And there's different costs associated with these options. So the first option is to actually go ahead and get yourself a HSCN connection. Now you can do that individually or collaboratively. Or the second 2 options, options 2 and 3, are about using someone else's connection. The option 2 is to ask a system supplier to use their connection. And option 3 is about asking a provider to submit on your behalf. So we're going to cover them in a bit more detail in the next slide. Now, NHS Digital doesn't maintain a register of all of these types of arrangements across organisations. So what you'd need to do is investigate these options locally. And to do that, it may be best to speak with your local commissioners, because at that higher level, your commissioners may know what providers in their patch are currently doing. So there may be some local collaborations already in place, or the commissioners may have made special reservations to allow funding for organisations to get access to their own connection. So we definitely recommend speaking with your commissioners. So option 1 is to go ahead with a procurement of your own HSCN connection. Now, our team are not experts in the HSCN, but there is a team that are experts, and we've included a link to the website. So there is a web page specifically to do with procurement options, and various options exist. Some of these options are NHS Digital led, which can be less burdensome, or you may choose to lead your own procurement if you've got your own specific requirements. It's just to note really that there's a collaborative option where you may want to join forces with some of your other local organisations to progress a procurement across yourselves, and that may be cheaper and easier to do within sort of a network. The second option is a system supplier option. And this is we've only been aware of this quite recently. So we've been made aware that an independent sector provider have recently started to submit the MHSDS, but they've been using their system supplier HSCN connection. Now this is subject to local information governance arrangements, which you've probably already got with your system supplier, and you may just want to consider them. So one of the options really is to contact your system supplier to determine if they offer this service. So option 3, ask a friendly provider to submit your data. So we recently redesigned the MHSDS, and as part of that redesign, we wanted to make sure that we included a solution to enable organisations to make submission on behalf of another organisation. It was a key requirement for the redesign, and we have implemented this solution within the MHSDS. So as you can see in the diagram, there's a header table and a data set that contains administrative data about the submission, such as what data does it cover, when did you create the file, what system are you using. But the two key items that are highlighted in red, there's an organisation identifier code of provider. Now that is who does the data or activity belong to. And the second item is the organisation identifier code of submitting organisation. Now this is who is physically making the submission. So as you can see, there's two different items where you could show that organisation A is who the data belongs to, but it's organisation B who is submitting the data for organisation A. Now again, this is subject to appropriate local IG arrangements being in place, and in particular that data processing and sharing agreements are in place between the two organisations. So if you did want to progress this option, you may want to contact your local neighbouring services or larger trust to determine if they can offer this service. Now we are aware that these arrangements do exist, we just don't have a central register of who's actually using this option. So for options 2 and 3, these involve data sharing, and it's just worth highlighting additional considerations that would apply if you were to go down with these two options. So if organisation A wanted Org B to flow the data on their behalf, they'd need a contract and a data depositor agreement. Now this agreement would place organisation B as a data processor and organisation A as a data controller. So the data controller would contract Org B to undertake the submission of the data on their behalf. So organisation A, who the data belongs to in the first place, will need to ensure compliance with the GDPR regulations, such as by undertaking a data protection impact assessment. Now, there's no templates for such agreements as these are local arrangements, and NHS Digital would not warrant to offer any indemnities. So it is a local undertaking. You need to check with your own internal teams to make sure that's done appropriately. However, there are a variety of different helpful resources in existence. For example, the ICO publish data sharing guidance on their webpage, and that includes various checklists and case studies of how that's been done successfully in the past. That may be something you do want to consider. Just to know, if you were to do options 2 and 3, so these options would negate yourselves having to obtain your own HSCN connection, which is obviously one of the 6 steps you wouldn't have to go through. Now, some of the other steps you will still need to go through. So you might not need a HSCN connection in these cases, but you still would need to complete some of the other steps, such as ODS registration. So I'm just going to hand over to Claire now, and Claire's just going to go through their journey at Bromley Y to acquiring a HSCN connection.
Thanks, Aaron. I just want to be clear that I'm a clinician, not a technical person in any way, and I began this process very much from a position of not understanding how to navigate the process. I did find the information online hard to follow, and it's spread across many different sites and agencies, so hopefully through doing this webinar, we're hopefully making the process a little bit simpler for you. So how did I start off on this journey? My first step was to discuss the dilemma that we had with our CCG commissioner, thinking about could they sponsor the service to acquire the connection, could they offer any technical guidance, and most importantly, could they support the service financially in the process? Quite a big undertaking for us, having to pay the fee for the connection and spend time actually going through the process. So I think we were really fortunate because via transformation monies, the CCG decided to support the cost of the connection for the next 3 years and signed off a sponsorship for us to begin the process. And I think they recognised the importance in the service being able to flow data both locally and nationally, so we're really, really behind us. So I proceeded slowly, and by choosing the simplest approach, basically I felt overwhelmed by all of the information at hand, and I didn't really know where to start in the process. So I began by thinking about the fact that as a third sector service, we don't collect NHS numbers for children and young people referred to the service. So with the people who write our database, we added client IDs to each referral to get around this problem. We then had in-house data that could be anonymised and shared at a local level on a monthly basis with commissioners, which could then be compared with future reporting from NHS Digital once we were up and flowing the data. Also, in terms of IT infrastructure, the simplest process for us was to choose a single PC laptop, which would be connected to the HSCN, which would be solely dedicated to flowing the data, and that seemed to be the most manageable method for us. When I was looking at all of the IT infrastructure around this, it could come across as very complex. So we chose to use a laptop that was completely separate from all of the other IT performance within house. So as part of the journey, we needed to create a lot of local policies and documents. Being a third sector service, we had very little information governance in place. As a non-NHS service, there was no onus on us to have a Caldecott Guardian, and we were not CQC inspected. And I appreciate that for some third sector services that are very small, it might feel like a really big undertaking, but I really think the journey was worth it. The impetus for acquiring a connection was to flow data centrally and share the amount and quality of the work we were delivering. However, this started off as being the premise for going along this journey, but it quickly became clear that there were other organisational gains from completing the process. Making the service more robust in terms of information governance would benefit both the children and young people using the service and the staff within it, and it would enable the organisation to have a much stronger foundation for future funding bids. Understanding what would be needed in terms of policy did, at first glance, seem overwhelming. I didn't really understand the purpose of some of the policies or how they may apply to the organisation. So methodically, I began by taking each of the policies in turn and looking for examples online that I could adapt to better fit the organisation. Thanks, Aaron.
Yeah, thanks, Claire. That's really useful insight. So just to round off the HSCN section, I guess it's just to reiterate the fact that there is a HSCN team out there that are able to provide support throughout this process, and just to contact our central inquiries at NHS Digital to get in touch with that team. So we'll now move on to the second step as part of the 6-step approach. So the second step is to ensure that your organisation is registered with the Organisation Data Service. So an ODS code, an Organisation Data Service code, is a unique identifier that's allocated to an organisation, and you can have more than one because it can register your individual sites. So we issue these codes to organisations to allow them to interact with the health and social care sector, so all of the national infrastructure and regional infrastructure, and it allows you to access the national IT systems and services. Now, you may have already registered with the ODS, and if you do, then that's great, because the ODS codes, like I said, are not just used for the MHSDS, they're used for all sorts of various purposes. So if you do have one, then that's great, but if not, there is a process to register yourselves with the ODS team, and we've included a link that takes you to the page where you would submit an application to obtain an ODS code. So Claire, do you just want to talk about this step for Bromley Y? I can see on the next slide that there is, you can quite clearly see in the diagram that Bromley Y are registered with an organisation code of 8JF69.
Yeah, I think registering the organisation was perhaps the easiest step of the whole process. And then the ODS code is used throughout the process as the organisational identifier, so it's really important to have this. Services can register as NHS or non-NHS providers, and your service will then appear on a register once this process is completed. I found that holding all of this information together was crucial. I created a folder throughout the process, mostly to demonstrate to myself that progress was being made, but also to ensure that I held all of the information in one place to refer back to and ensure that I completed each stage. Because sometimes it felt as if I was really not making much progress because it seemed like there was a lot of work to do. So being able to have that in hard copy within a folder to actually show me and evidence to me that I was making progress was incredibly helpful. It also helped with future staff training and sharing of information with the trustee board because I had everything in one place. Thanks, Erin.
Thanks, Claire. So the next slide, it doesn't really have any guidance as such, but it's just to highlight ODS codes in action. So I've taken a screenshot of our monthly MHSDS data quality report. So this is published on a monthly basis. And within that report, there's a coverage tab, and that shows you all of the organisations that are submitting data to the MHSDS. So like I said earlier, at the moment we've got around 106 providers submitting data, and the ODS code is vital for us to identify your organisation. So within the screenshot, you can actually see Bromley Y towards the top. So you can see that Bromley Y is submitting data each month. And just to make an observation, the number of records and the quality of the data is vastly improving month on month, which shows that the organisation is starting to submit data, but also taking necessary steps to sort of improve their coverage and quality of the data. So step 3 is about the Information Governance Toolkit. Now, this is not an MHSDS specific activity, but it's just a general reminder of local responsibilities for information governance. Now, all health and social care service providers, commissioners and suppliers who handle patient data must have regards to the IG Toolkit standard and provide evidence against requirements through an annual submission. Now, what is the IG Toolkit? The IG Toolkit draws together all of the legal rules and central guidance that exist for IG and presents it in a single standard that covers all of the IG requirements. So organisations that are in scope of the toolkit are required to carry out a self-assessment of their compliance against these requirements. Now, depending on your organisation type, you will have different sets of information governance requirements. So there's a link on the slide to where you can find out more about the toolkit, and we would strongly advise you have a look on the toolkit website and just see what may be applicable to your organisation. Now, unlike the process previously, it's just to note as well that the IG Toolkit is no longer a requirement to access the HSCN. So you can start the HSCN process pretty quickly without delay if you're not already undertaking the IG Toolkit within your organisation. So I'll just hand over to Claire. So what did you do, Claire, with respect to the IG Toolkit?
Well, I'm kind of in two minds here because I was thinking, gosh, I wish it hadn't been part of it when I was trying to get the connection, but it actually had huge benefits for the organisation. So I think overall it was incredibly helpful. and especially with the GDPR new regulations coming into play, that any services that have completed the toolkit will be in a very good position for that. So completing the toolkit was arduous and needed to be taken stage by stage. And the way it works is that as each policy is written, it needs to be evidenced within the toolkit, and you can then move forward to the next part to completion. It's quite methodical to work through. As I wrote each of the policies, they were then shared with the trustee board and signed off with their agreement. And in terms of completing the steps to flowing data, the policy document that I found the hardest was the logical connection architecture document, which I made mention of in a previous slide. It's a means of visually illustrating how the data would flow from what IT system and describe what firewalls were in place to safeguard the data. I really did not understand what this document was about, and the way I managed to work it out was by looking online for guidance and reading up on the importance of the security of flowing data. Then it started to make sense to me, and then once I thought that I had something that was workable, I could then speak to the Exeter help desk and people at the Bureau Service portal to get some further help with it to completion. As I said, I did find it difficult to find appropriate online templates, in that most of the documents applied to large NHS organisations rather than third sector services. So what I did was I gathered various versions together and then read through a lot of them to look for the most meaningful elements, so that I made sure that they were included in our policies and it was tailored towards the work of Bromley Y. And in doing this, it was very clear to me that the whole purpose and point of creating information governance policies is that they need to be implemented within service and not solely written and stored away. So any staff within service need to be made aware of these new policies and procedures and given training on them. And we also wrote it into staff induction packages and into the staff handbook. And of course, the trustee board need to sign them off and be aware of them too. And writing these policies helped us to recognise what we were already doing that was good practice in terms of information governance, and also how we could improve upon this as an organisation. Thanks, Aaron.
Yeah, thanks, Claire. I guess it's just to highlight as well that some of these policies and steps are quite specific to how an organisation should be operating locally. So within the MHSDS implementation guidance, there's an IG section that's tailored a bit more specific about some of the considerations you would have specifically in relation to submitting data to the MHSDS, such as in terms of patient consent, etc. So the implementation guide for the MHSDS is quite a useful document to have a read through when you're coming on to the process of sort of reviewing your IG practices. So that's step 3, the IG toolkit. We'll now move on to step 4, which is the requirement to ensure that a senior information risk owner, a CIRO, for your organisation is registered on the CIRO register. So the CIRO register is maintained by the organisation data service, so the same team you'd apply for an organisation code. So what is a CIRO? So CIRO is someone who would have overall responsibility for an organisation's information risk policy. Now that would typically be an executive director or a member of the senior management board. So the CIRO is accountable and responsible for information risk across the organisation, and they have a responsibility to ensure that everyone is aware of their own personal responsibilities to exercise good judgment and to safeguard and share information appropriately. Now, you can register deputy CIROs, and again, you need to make sure these deputies are registered on the Central National Register. And a different role as well you may need to consider having within your organisation is an information asset owner, an IAO. So an IAO, again, will be a senior member of staff who've been nominated owner for one or more identified information assets in the organisation. So the IEO would support the CSIRO in the implementation of the overall information risk management function, which again would be defined in some form of organisational policy. So the IEOs would be delegated by the CSIRO, and it's an IEO nomination form that would be sent by the registered CSIRO through their email address. And there's a link at the bottom of the slide on how you would check if your organisation already has the CSIRO and IEO roles registered, and if not, there's a form that you can complete just to add the registration details. So Claire, in terms of identifying these roles locally within your organisation, how did you go about doing that?
Well, I think it's interesting hearing all the acronyms again, because I think when you start off on the journey, you really don't understand what they mean at all, and it's only through going through the information governance process that you start understanding where they sit and the importance of them. So, you know, as I said earlier, as a third sector service, we're not CQC inspected, but in order to go through this process, we needed to have a Caldecott guardian and a CSIRO. It made sense for me as director to be the Caldecott guardian, and so again, I researched this role online to understand its purpose and its scope. And at the time of registering, it was important to have a wet signature on the form. It couldn't be done simply online. And again, you then go on and register as the Caldecott guardian for the organisation. Having the ODS code made this process pretty simple, and I also registered at the same time as the CSIRO, given that I was compiling the policies and procedures. Obviously, I'm not in that service currently, and other people have taken over that role, and it's pretty simple once you have your ODS code to be able to change the names attached to these positions. The information for the Caldecott Guardian and the CSIRO was shared with staff, commissioners, and appears on an open register. And again, it's a means of ensuring compliance in terms of information governance and for taking responsibility for current and future organisational practice and staff training. Thanks, Aaron.
Thanks, Claire. So why are all these positions within the organisation really important to define? Well, step 5 is to request access to the BSP through the completion of a data user certificate form, a DUC form. Sorry, Claire, another acronym. And that's available from the BSP webpage. So why were we talking about CSIROs within an organisation? Well, the CSIRO is responsible for user access into SSD service systems and service delivery systems, and that includes the Bureau service portal. Now, why is it important to have this responsibility? Well, the BSP is not just used to submit data, it also hosts all of the historic data you've submitted, so that if you've made if you've been submitting data for a while, we can go back and look at the submissions you made, 2 or 3 months ago, and see where data quality issues might have had a knock-on effect, etc. So there's obviously a lot of data on the BSP, and that's why the CSIRO is responsible for managing access to that system. So the DUC form would need to be submitted and approved by the CSIRO, but they can also name a deputy CSIRO or an information asset owner to sign off the DUC form. So if we do have these deputies or IAOs registered, then that can take some of the burden off the CSIRO, but only really when the CSIRO is absent and the application is urgent. Otherwise, it should really be the CSIRO. So where can you find this data user certificate? So there's a link in the slide to a dataset page, and that dataset page has got all of the DUC forms. So on that page, there'll be an MHSDS specific DUC form. And that would be submitted to the Exeter Help Desk, and that will grant you access for the people on the form to access the Bureau Service portal. Just a general tip, you can register multiple users onto the portal, and that's quite important because obviously the data set's submitted monthly. If you've only got one person registered on the portal and they happen to be on holiday during the week that the submission deadline is on, then you're not going to be able to submit the data. So if you do register multiple multiple users, at least you've got that comfort net that you can cover the submission across the team. So Claire, in terms of registration to the BSP, how did you undertake that within Bromley Y?
Well, this really felt like we were coming to the end of the journey, so it was really great to get to this point, and having completed the IG toolkit, which took such a long time, I was then able to register the service on the Bureau Service portal to be able to flow the data to NHS Digital. This is pretty straightforward, and as the CSIRO, I could nominate the data manager and assistant psychologist who would take responsibility for actually entering the data for each submission. And as you said, Aaron, I think it's really important to recognise that people will take leave when the submission window is open, and you need to have a few people within your service who can actually log on and flow the data, not just one individual. And it's pretty simple to add and change permissions to enable the service to add and remove staff members as needed to be able to do this. Thanks, Aaron.
Yeah, no problem. And again, just to highlight as well that, within NHS Digital, we are constantly reviewing our processes. So, for example, the DUC form, probably at the time, Claire, when you completed it, needed a Caldecott Guardian signature. They needed to be sent via Royal Mail or fax to the authentication team. We've now streamlined that process much more so that a CSIRO or Deputy CSIRO or IAA can submit the form, and they can do it through an email as well. So as long as it's the CSIRO's email, the email comes from the authentication team will accept that. So yeah, we are trying to make things a lot easier as we can. The last step, there's not a lot to say about this really. So once you've got access to the Bureau Service portal and you've got the connectivity to log on to the Bureau Service portal, you might just find that you need to configure your firewalls and IP addresses. But if you do have any problems accessing the portal in this respect, then just please contact the Open Exit Help Desk. So there's an email address and a telephone number there, and they'll be able to help you just make sure that you've got everything set up to access the portal correctly on your browser. So that's everything from me. I think we've covered the 6 steps that are required from a technical perspective to get an organisation up and running on a Bureau Service portal to submit the data. Claire, I don't know if you had any more general tips for services about undertaking this process.
Yeah, thanks, Aaron. Well, lie down in a dark room for a few hours before you begin, and make sure you've got lots of help and support and people to talk to throughout the process, because you may need it. It was a long process, and it only succeeded by perseverance and allocating the appropriate time. As I said, I'm a clinician and a manager. I'm not technical in any way, so if I can complete it, I'm sure most people can. It did take about 6 months to complete the full process, and it needs a real commitment from the organisation and hopefully your CCG as well, because it's to their benefit too. Ideally, 1 or 2 people need to take responsibility for seeing this whole process through, and there needs to be managerial oversight and support for these people. Speaking with your CCG and gaining their support, financial or otherwise, can benefit both them and the organisation in understanding accessibility to the service and the outcomes for the children and young people being worked with, because ultimately that's what flowing the data is about. I did seek a lot of help from the Exeter Help Desk, and they're brilliant because you email them or telephone them and they get back to you pretty much straight away, or put a ticket on something so you know the time frame to wait. And throughout the process, they enabled me to stay on track. But ultimately, this process has hugely benefited Bromley Y and ensured a more robust structure and a sharing of data that will hopefully further understanding into what interventions might be most helpful for children and young people. And although it was exhausting, I'm really glad that I was part of the whole process.
That's great to hear, Claire. Thanks very much for that insight, which I'm sure will be of benefit to organisations who will be at a similar point in time as Bromley Y was at the beginning. Again, in terms of the time it can take, we would strongly recommend having a look at the 6 steps straight away, work out where your organisation is, because you may already have done some of these steps already, which can certainly speed the process up to get the submissions up and running. But if you are starting from scratch, then hopefully this presentation has covered most of the questions you will have. But if you do have any further questions, there's just a last slide at the end that can show you where to get in touch. So the Exit Help Desk, as Claire's highlighted, are fabulous for contacting, specifically in relation to the portal, in terms of the data user certificate and the technicalities of getting onto the portal. But if you do have wider questions, maybe in particular about what data you should submit and how you can capture that data, then you can contact NHS Digital through the central inquiries. So our email address is enquiries@nhsdigital.nhs.uk, and with the telephone numbers on the slide as well. But the NHS England CYP Mental Health National Team are really supportive as well, and they do host a monthly data surgery. So if you do have a question that you'd like answering on one of these monthly surgeries, there's an email address on the slide to pose that question. And NHS Digital are involved in these data surgeries as well, so we do cover quite a wide range of issues. So I think that's about the end of the presentation and what we was hoping to cover. Just pass back to Jessica now at NHS England. I don't know if you've got any closing comments.
Nothing in particular from me, just to reiterate that I hope this is a useful resource to everybody who's been listening to it, because we know that this isn't always easy, and as you both said, I think there's quite a lot here that's actually just about perseverance, but you'll get there. As well as a big thanks to Aaron and Claire for taking out time from what I'm sure are very busy working days to create this resource for us. So thanks, guys. And as Aaron says, if you have any further questions or anything that you need a little bit further clarity on, do let us know through either of the email addresses that's on this final slide, depending on what the nature of your query is, and we'll try and get back to you as quickly as possible with something that helps. Yeah, I think that's it. Thanks, everyone.
Yeah, thank you. Thanks for listening.
Thanks a lot.
Okay, bye.